I'm excited to dive into erectile dysfunction tonight. So nothing more exciting than that, right? So I'm really excited for this topic. It is such a common issue that comes into my clinic as far as people presenting with sexual dysfunction or sexual concerns or even sexual myths and stereotypes that affect this problem in particular. So I'm very excited to dive into it. I want to just kind of give the friendly suggestion to not wait until this becomes a problem in your life to educate yourself about it. Unfortunately, a lot of the pitfalls and things that you can avoid very early on are not oftentimes avoided because people, males in particular, are uncomfortable talking about this issue, don't necessarily seek help to get answers or get kind of information that would be very helpful. So educating yourself about any type of sexuality issue prior to having the issue yourself would also be a very good reason to listen to this webinar, even if you're not struggling with ED yourself at this particular moment. We are going to start off by addressing the many myths and misperceptions and kind of miseducation that people have about erectile dysfunction to begin with. So we're going to be talking about diagnostic criteria, what erectile dysfunction even is, and whether or not people are contextualizing those frames correctly. Because the reality is that most men will experience a time in their life where they do not have an erection when they want one. And that does not automatically put you into erectile disorder category. So that's actually fairly normal, and we'll talk about many of the reasons why that can happen. We are going to delve into tonight the number 2 area, which will be a lot of the physical reasons and biological reasons why erectile dysfunction can be something that people experience. So anywhere from medical conditions, medications you might be on, substance use that you may or may not be aware of as far as how that affects dilation of capillaries, arteries, veins, etc. Lifestyle choices and how they might be affecting some of this. And also I'm going to slightly go into the common fear that I'm hearing a lot of about whether or not looking at pornography or erotic imagery, if that could be affecting erectile dysfunction somewhat. So we'll be looking at that as well tonight. The number 3 tip that I'll be delving into is a lot of the psychological aspect of ED, which tends to be primarily anxiety based. This can be called like the anxiety loop or a vicious cycle. And we'll talk a lot of the typical patterns and kind of cognitive distortions that people can get into in thinking about their erections and why those ways of thinking about it can actually exacerbate the problem instead of helping it. So what's important for you to know is that most people will deal with some type of erectile dysfunction at some point in their life. That happens whether you're a male or a partner of a male. And so tip number 4 is, so what do we do about all that anxiety? So we're going to come up with a lot of different strategies and methods and things that can help males relax, be mindful, understand their body, understand pleasure, give themselves some ways that they can handle anxiety so that they're not falling into that anxiety loop. And then the number 5th tip is the relational aspect. So most times men are concerned about erections because they're wanting to have some type of partnered sex. Not always. I mean, sometimes these issues can come up also when men are masturbating, having solo sex, but for a lot of times it's, I'm wanting to have a sexual encounter and I'm concerned that my penis isn't going to act the way I want it to act. So it starts having a lot of relational components. And how do spouses or partners, heterosexual partners, homosexual partners, bisexual partners deal with some of these concerns? And sometimes, we think we're being helpful and we're not. We're not aware of ways that we may be shaming inadvertently. Sometimes we may have our own feelings or meaning ruts around what a lack of an erection means. So we're really going to dive into that issue as well. So we have lots of great information. I hope that you will join us. Happy sex and life and all those healthy, wonderful things. Take care, everyone. Good night.